Hello, and welcome to our quick talk on shingles. This is not a medical talk, but it's a quick talk. I'm Norah Grant. With me also is Gail Wiegman. We are both trustees for CLL Support, helping you live well with CLL. This is not a medical chat. We are not doctors. But we just want to talk about some of our experiences with other people that we know who've had shingles. And we think it's important for people with CLL to know about shingles. Gail, what is shingles?
It's a virus that attacks your body. You will have had chickenpox. Most people have had chickenpox as a child, and the virus stays in your body and then comes out in like a chickenpox type thing, little blisters. In circles or in one line. Usually it's one side of your body. If you get it, it can be very, very nasty. And CLL people are very susceptible to it.
What are the signs and symptoms?
You'll start off by feeling generally unwell. I think it's a feeling of high emotion. It's definitely an attacks your nervous system. But you feel generally unwell, and you can have pain in the area. So you can have a severe backache, for example, and think that backache is muscular and all that sort of thing. And then I think after about 3 or 4 days of the pain and the ache, the rash comes out. And it's within 72 hours that you need the medicine after the rash comes out. You need this medicine called acyclovir. But the rash can look like little tiny blisters, and they can be in a line or a circle. But as I said previously, they're mostly on one side of your body. But they can start on your back and they can move round to your front, and so it comes in like a belt around your body. And there's been some dreadful cases. You can look. Yeah, this is where I would say you possibly should Google. You see them on the the internet with people in their eyes and in their hair and that sort of thing. So those are the symptoms.
One of the other reasons you've reminded me that we are talking about this is because Shingles is now available on the NHS, if you're between the ages of 70 and 79. And Shingrix is the shingles vaccine that people who have CLL should be getting. So it's great news that it's available now. So hopefully you're going to talk to your GP and your hematologist about when and where and how you're going to get that vaccine if you're between the ages of 70 and 79.
I believe that Mark Auckland, our chairman, is talking to a consultant at the moment because we feel there's some ambiguity about the advice given to GPs, and it may be that we're going to be pushing for Shingrix vaccine to be given to the under 70s. I'm not sure of that yet, so I think it's a bit of a watch this space.
I have a friend who was walking around holding her head, and she finally went to A&E because this headache was only on one side of her head. And she mentioned the little dots that were just sort of here. And they were like, yeah, that is shingles. She got the medication, the acyclovir, I think. And it helped a great deal. And then the thing that can also make this virus pop out is stress.
Stress is something, you're on watch and wait, or you're post FCR and you're going along. And COVID has been very stressful for a lot of people with their businesses and different stuff. So that's the time when you're very vulnerable. So that's the time now. If you can push to get yourself the vaccine, and keep look after yourselves.
Which brings me to a very good point. We have the lovely new addition to our website, the ACT therapy, ACT, which is full of grounding exercises, stress relief, centering and getting a different perspective on your stresses and anxieties to try to control them. So I didn't think we were going to talk about that today, but it seems a perfect segue into, mental health, stress from jobs and from all, renovations to your house, whatever it is. You need to take the deep breath, breathe through the abdomen, check out the grounding exercises on our website, ACT, ACT therapy. Now, are there any complications that can arise from it?
With CLL, your immune system is obviously not as healthy as somebody, even people on watch and wait. So if if you take this acyclovir within 72 hours, I believe, and again, I'm going to emphasize, I'm not a doctor, neither of us are doctors, but you can mitigate symptoms. But if for some reason you don't and you get it in on the 4th day or something, maybe, the shingles will keep going a bit longer, because they give you a course of acyclovir for 1 week. It's a huge course, 5 tablets a day. It's a huge course, but it only lasts a week. So if at the end of that week you're still producing blisters, then you may need further treatment. You may need IV acyclovir. And this has happened to somebody that I know. And another complication is your body is in shock, and you've got the rash, but internally your body is fighting this virus, and it's a hideous virus. So your body's in shock. So then your body's also at risk of bacterial infections. That we all know that bacterial infections can just turn up. You don't need to touch a dirty surface or pat a dog or whatever it is. Our body's full of bacteria, and we know that bacterial infections can just whiz us up at any time, and we can get all sorts of stuff, which then your body goes into overdrive because it's trying to fight a virus and a bacterial infection. And then that's when you will get this huge fever, because for the bacterial infection. And at that point, you're in serious danger of something like sepsis. So you really have got to be aware of all of these things. And if you're with CLL and you just want to lie down and go to sleep, you just think, I'll just sleep this through. Do not do that under any circumstances. You go to A&E.
Yeah.
And what happened with the person I know is that after 8 days, the blisters were still coming. They were not going. And also a fever had arrived, and then a bacterial infection had taken hold, and all of a sudden you're in A&E, hooked up to everything in the world, and that's brilliant because they sort you out. But you need somebody to take you to A&E, or you need to go to A&E and you need to have worked out that you need to go to A&E.
Right.
You need to keep in touch with your GP. At the end of the 8 days, if you're still getting little blisters, you don't go, that's fine. You go back to your GP and you say, I've got little blisters still coming up. This is certainly not in any way meant to scare anybody, because most people will just get shingles. The acyclovir will work for a week. There's a lot of people take acyclovir, a very small dose every day, and will prevent them getting shingles. It really should do. And that's why a lot of people take it. But you only take it for 3 years after your treatment or something like that. So unless your immune system has gone back to complete normal, so a lot of people will have had FCR. Now, FCR, sometimes your lymphocytes never get beyond 1 if they get up to 1. So maybe with the newer drugs, this isn't going to be as relevant. But certainly people in the past that have had FCR, their acyclovir will have stopped after about 2 or 3 years, maybe. And I don't know if people on ibrutinib, if they're on it as a what's the word, prophylactic, then maybe they won't get shingles.
This is such good information, Gail. You have the rash, okay, we've established that, but if it's still going 8 days later, and if you get a fever, that indicates bacterial infection, which now needs antibiotics. Okay, did we want to say anything more about that trip to the hospital, the trip to A&E?
Yes. If it's at all possible, go to the hospital where you're treated, who have got your notes. It's much easier to walk into an A&E department that's been treating you, has got all your oncology notes, all your hematology notes, all your notes on everything. And if it's not possible, it's not possible. But I think that life becomes a lot simpler for the hospital if it can look up your notes. So
yeah, good idea.
Yeah. The other thing is that if not, possibly try and stay in the same hospital trust, because then they may be able to get your notes. It is difficult. It is complicated if you're in a separate hospital trust. I mean, if you're on holiday, if you're somewhere else, you can't do that. Obviously, you've got to go with where you've got to go with. But
and the key is you have to tell them, I have CLL. I have shingles. You have to self-advocate when you arrive at the
Absolutely.
emergency. You have to spell it all out. And then they will know, okay, this person has a leukemia. They are, fragile, and they will get the job done, even if it's not your hospital. I just want to reassure you. I agree. Yeah. It's good to go to your same hospital, but if it's not possible.
No, I mean, any hospital will look after you terribly well. I'm not saying that. I'm just saying if it's possible. That's all I'm saying, is that having your notes for them to look at is really very good.
I think it's a good idea to have a little bag packed, ready to go, regardless of what it is, if it's shingles or not, or at least sort of a list of things that you want to put in that. The extra toothbrush, and your own pajamas, so that you can put them on when you're in the hospital.
And if you feel having your bag there's, too depressing, just have maybe all of it in one drawer, so that you could just go to that drawer, whatever it is, whatever makes you happy, but be able to leave the house with that bag is great. I would also say, and these are just general points for CLL people that you and I've talked about over the years, Norah, I would always have an ear thermometer at home, so you can take your temperature very accurately. I would have an oximeter just for COVID at the moment, just because that's a good thing to have. And I would always try and keep paracetamol in the house to try and get your temperature down, because they'll just give you paracetamol as well when you get to the hospital. But it's good to keep it at home if it's a possibility. It does bring your temperature down. It's a wonder drug, really. I just really want to emphasize that Norah and I are not doctors.
Yeah.
This is just a chat between two trustees, and we hope we've covered everything, don't we, Norah? But we possibly haven't.
Yeah.
Please feel free to contact us if you want to talk about it. Ring the helpline or Norah's WhatsApp group, but I think we've covered it. But also, don't panic. Sometimes shingles comes, you get a tiny little blister, you get your cyclovir, it's gone in a few days. We're not giving you scare stories.
Yeah, exactly. And if you have questions, do some research, talk to your GP, talk to your hematologist. They can help you too, because we're not doctors. Yeah. Okay, great. Talk to you next time.
Bye.